Minor ailments. Acute conditions and problems are noted. The nurse or any other health worker should always. What the? Okay, first step is to collect data. General health history, specific history regarding the onset, duration, problems associated, symptoms, past history of the illness, and the family history of any illness. Record vital signs and urine examination. Identify the problems and give care according to problems. Implement nursing care. Evaluate the progress. Notify if any communication disease, fever. Check the vital sign, observe the sign and symptom, headache, nausea, vomiting, diarrhea, running nose, cold, cough. Advise bed rest and light diet. Take blood smear for malaria. Give antipyretics. Advise plenty of oral fluid, example fruit juice, rice, water. If patient is having hyperthermia, give cold sponge. If any rashes, know the type and the distribution of the rash. Isolate the patient, inform medical officer, primary health care. Cough, find out the duration of the whooping cough. Color, amount of sputum, whether there is fever, sore throat, pain in the chest, dyspnea, vomiting, loss of weight. Give aspirin tabs, fluids, and the balanced diet. Aspirin tabs, fluids, or balanced diet. Okay. Advice for rest if TB is suspected. If TB is suspected, refer to the hospital. Throat. Record the vitals and inspect sore throat for evidence of redness and white patches. If the white patches and the other signs of diphtheria is seen, refer to the hospital. Send a throat swab to laboratory. Laboratory. If pharyngitis is present, give saline gargle, give aspirin. If there is history of recurrent tonsillitis, refer to hospital for treatment. Advise syrup of honey with hot water. Inflamed eyes or the eyes with discharge, wash eyes with water. Unclean with cotton swab, cover with the sterile iPad and bandage. Refer the patient to hospital when any wound that cuts or ruptures the eyeball. If any history of the tonsillitis, refer to hospital for treatment. Earache and the discharge from the ears. Clean the ears, apply ear drops prescribed by the doctor, give paracetamol tabs for the 3 days and refer to healthcare. Each ear discharge with the external ear soreness, clean with the boric acid and lotion, apply ear drops. If associated with the other problems like the nose and throat infection or impaired hearing, refer to the primary health center. Convulsions and fits. Make the patient lie down with head turned to one side. Place small and clean cloth between his teeth to prevent from biting the tongue. Do not restrain him or her during a fit. Well ventilated room provided in the loosened clothes. After he recovers from the fit, give him hot tea with the plenty of sugar. Protect him from any danger like fire, sharp stones. Obtain the history and refer him to a hospital. Diarrhea. Observe the sign of the dehydration, example dry mouth, sunken eyes, depressed frontally, loss of elasticity of the skin. If available, and the half cup of the orange juice or a little lemon juice. Children need at least 1 liter a day and adult 3.5 liters. Severe dehydration, refer to health center or the hospital. Teach disinfection and proper disposal of the stools. Advise a diet of rice water, coconut water, mashed banana, and the grated apple. Teach mothers to use disappears for the children to prevent further spread of the disease. Protect the food from the fly contamination. Advise the importance of drinking chlorinated water or the drinking boiled and the cooled water. Use fly control measures. Inform the PHC regarding the diarrheal situation. Constipation. Advise plenty fluids, fruits, green leafy vegetables, and the foods with natural fibers in order to have regular bowel movements. Older people need to walk and exercise. Advise mild laxatives to patients suffering from the constipation. Mild laxatives. Skin rashes. Check the vital signs, examine for the type, distribution, and find out the duration. A certain possible contact with the communicable disease, example measles. Isolate the client or the patient. Refer to primary health center, hospital. If patient having fever, give tab aspirin 10 gram for adults and the 5 gram for children. Wounds. Wash the wound with the soap and water. Apply ointment. Avoid contact with the dirt and dung. Refer to primary health center for the TT injection. If external bleeding there, apply sterile dressing. Elevate the part and apply pressure. Burns. Remove non-adherent clothing. Clothing away from the wound. Remove rings, bangles, shoes, belt before the part begins to swell. Assess the burn areas. Reassure the patient. Treat for shock. Transfer the person to hospital. If medical aid is delayed, start oral rehydration fluid. Animal bite. Wash the wound with the soap and water for animal bites. Observe sign and symptom of rabies. If the animal is without symptoms, wash the animal for 10 days. Flush the wound with the saline or the water. Apply ice to the wound to delay absorption of the venom. Shift him to hospital. If non-poisonous, clean the wound with the saline and the water. Apply tincture and then refer to the hospital. Tincture for the animal bite. Then the snake bite. If poisonous, apply tourniquet or cloth to impede venous blood from the side of the bite toward the heart. Small cut into each fang mark with a clean knife about 1 centimeter long and 1 by 2 centimeter deep. Suck the poisonous through suction machine and the breast pump. Wash the wound with the saline or water. Apply ice to the wound to delay absorption. Person lie quietly. Do not move the part that has been bitten. Shift him to the hospital. Scabies. If one person has scabies, everyone in the family should be examined and treated. Isolate the patient and tell patient take bath, scrub well with the soap and water. After that, dry the skin and apply calamine lotion before going to bed. Continue for 3 to 5 days and give bath. Advise to wash the clothes and boil them and dry them under the sun. Schoolmates, playmates, family members should be examined and treated. Examined and treated and advise the wash and boil them and dry them under the sun. Schoolmates, playmates, family members should be examined and treated. Tell the patient this treatment is incomplete unless one or more course of treatment for 3 days is done. After a period of 2 weeks, if not done so, the scabies will occur again even in the absence of the reinfection from the others. Fracture. First, immobilize the part with foot boards. Give support the injured part of the bandage and slings. Shift the patient to hospital. Okay. Give if any major fracture suspected, immediately shift to the hospital. Heat stroke, record vital signs, provide bed rest, and give plenty of fluids. Give cold sponging, apply ice bags to the head, groin, and axilla. Remove the person away from the causative factor as quickly as possible. Anemia. Advise the person to eat ragi green leafy vegetables like the spinaches, amarnath beans, peas, jaggery, and egg and liver. Advise oral iron and the vitamins. Advise dried fruits, raisinry dates. Stool examined for the hookworms. HB test, bleeding piles. Menstrual disorders with excessive bleeding and other bleeding condition have to be referred to primary health care and the hospital immediately. The edema, advise low salt diet, daily records. Intake output maintained, find out the cause and the refers to primary health center, examine the urine for albumin. Nagine ishq de vekhe. Bleeding nose, make patient set up with the head erect and the bent forward, loosen all clothes at the neck. Tell patient to pinch nose at the junction of the hard and the soft part. Apply a cold press. Do not let him blow the nose. Transfer patient to the hospital. Shock. In this case, the foot of the bed raised about 22 centimeter. Give first aid for bleeding, fractures, bites. Keep him warm and reassure the patient. If patient conscious, give strong hot tea with the plenty of sugar, provided he is not expected to undergo anesthesia. Standing instruction orders are the specific instructions regarding treatment for condition that nurses and the other health workers may meet in the home, school, and industries where doctor is not readily available. The instructions are the issued jointly by an authorized medical officer. Standing instruction order. And a nurse or committee with a nurse representative in it, as standing instructions are intended to provide treatment only in the emergencies and temporarily in the absence of a doctor. They should be limited. But the medical officer is legally responsible for the diagnosis and the treatment of the persons who are provided health care by the health department personnel under his jurisdiction. He issues standing instruction. He has faith in the sound judgment of his staff and expects them to use the order cautiously. He also expects the worker to refrain from the following the orders when in doubt. The condition should be reported to the medical officer or a clinician in the special circumstances as soon as possible. Every health service should issue standing instructions to meet the needs of the health problems in the area. General nursing care during minor ailments, collect data, reassure the individual, explain the disease, evaluate the progress, identify the problem, implement nursing care, record the vital signs, general health history.